Intrathecal injections. Introduction. It is normal to feel pain during an intrathecal injection, and you should not tell your doctor about it. Select true or false. Correct. Pain indicates the needle may be touching a nerve. Always tell your doctor if you feel pain, particularly pain in the legs. Infections often occur after an intrathecal injection. Select true or false. Correct. Infections are very rare after an intrathecal injection. An intrathecal injection can affect the functioning of the bladder. Select true or false. Correct. Some short-lasting urinary retention may be normal. However, in a few rare cases, bladder problems may occur because of internal bleeding following an intrathecal injection. Be sure to inform your doctor so that you may receive treatment. Allergic and drug reactions are very common after an intrathecal injection. Select true or false. Correct. Even though rare, these reactions could happen and could potentially, in very rare instances, lead to death. It is therefore very important to inform your doctor about all the allergies you have. Thank you for using Explain.